Okay, fine, fine. So we can start the session, and sorry for that initial technical glitch. So without any further delay, we can start the session, and uh, I have chosen some clinical questions from psychiatry from very important topics, and hopefully it will serve the purpose in the exam, right? So the very first question was about a lady who is repeatedly checking the gas stove and nearly 20 times despite knowing that it is off, right? So the lady is repeatedly going and she is repeatedly checking the gas stove whether it is on or off, and she knows that it is off, but she could not resist the compulsion to go and check the stove, right? So there are two terms which you should know, and obviously I think most of you must be able to understand or must be able to make a diagnosis of obsessive compulsive disorder. So that's the classical manifestation of obsessive compulsive disorder, right? So here you need to remember a couple of terms. One is obviously obsession, right? So obsession means there are continuous thoughts which are coming in the mind. So obsession means continuous thoughts. Clear? So obsession means the thoughts are coming in mind. Then what is compulsion? Compulsion means the act following those thoughts. So compulsion means the acts. And for example, in this question, the act is checking the stove. So that is the act, checking the stove. And third thing, which is option C here, is delusion. Now what is the meaning of delusion? Delusion means false unshaken belief. So that is a different thing. So false unshaken belief, right? Which cannot be, even if you give some evidence that, see, whatever you are thinking is wrong, but the patient will not listen to you. So these are three terms. Obsession are the continuous thoughts, compulsion is the act which follows those thoughts, and delusion is a separate entity. So for this particular MCQ, the best answer is compulsion. So compulsion is actually the act which follows the obsession, which are actually the thoughts. And this is what is the disease as such: obsession compulsion disorder. So thoughts are coming in mind, and the patient is is bound to follow those thoughts. So that's the classical case of obsessive compulsive disorder, and it's one of the very favorites. Please don't do any sort of mistakes in such questions. Okay, so that's one topic which is frequently asked: obsessive compulsive disorder. Then moving forward to one more important topic which is again asked many number of times. Now here, a 35-year-old executive suddenly develops palpitations, that is घबराहट, sweating, diaphoresis, then chest tightness, fear of dying, and because of this he reaches the emergency department. The attending doctor thinks of myocardial infarction, so the attending doctor goes for a ECG, but that is absolutely normal. So now what is this? So here let us take the key words which are given in this question statement, and very classical keywords. The moment you just go with those keywords, you can easily reach up to the answer. So one is sudden onset. Yeah, one is sudden onset. All of a sudden the symptoms, they start to appear. Palpitations, then sweating, right? Then most importantly, fear of dying. And fear of dying, that is known as impending doom. So the moment you have this word impending doom, fear of dying, The answer has to be panic attack. Clear? So sudden onset of symptoms with palpitations, sweating or diaphoresis and fear of dying, think of panic attack. Clear? So that is how you should answer this as panic attack. Then next question, again from a very important topic like mood disorders. Now here the patient has elevated mood, then decreased need for sleep, the patient is sleeping less, then increased goal directed activity, and then more importantly grandiosity for 10 days, and lastly this requires hospitalization. So let us take the keywords and we will get to know the answer here. So the keywords, one is elevated mood. Clear? So the mood is high. Then decreased sleep, the patient is sleeping less. Then increased activity, we call it hyperactivity. Then lastly delusion of grandiosity. So delusion of grandiosity. Now grandiosity means richness. So the patient will think himself as some king or some prince, or if she is a lady she will think herself of some queen or princess. So they will think that they are very rich, they will become extravagant, they will spend a lot of money. So that is all classical presentation of mania. Clear? So this is mania or elevated mood. So classical words, and this is very frequently asked, mania. Okay. The next question, a 70-year-old post-operative patient becomes restless at night, then he starts pulling out intravenous lines and is disoriented. And there is one more important keyword, the symptoms fluctuate throughout the day. So let us write the keywords first and then we can reach up to a classical diagnosis. So now here the patient is elderly, 70 years old. Then what is the status? Post-operative. The patient is in post-operative ward. Now what has happened? The patient has become restless, then pulling out IV lines, but most importantly he is disoriented. And lastly, the symptoms, they are not same throughout the day, they are fluctuating. Sometimes the symptoms are more, sometimes the symptoms are less. So this all goes in favor of delirium, right? So this is classical keywords for delirium: elderly, post-operative, disoriented. So there are two important differences which you should know between delirium and dementia. The very first is clouding of consciousness, right? So the patient with delirium shows clouding of consciousness, but a patient with dementia is fully conscious. That's very important. And second is disorientation to time, place and person. This is also a classical case of delirium, and in initial phase of dementia there is no disorientation. So these are the two important points to differentiate delirium from dementia. Third, you can also write fluctuation of symptoms. Again, it is present in delirium, it is absent in dementia. Okay, so these are few important differences between delirium and dementia. You should know this is a very favorite topic, and for dementia, always think of Alzheimer's disease. So to think about dementia, always think of Alzheimer's disease, which is a classical example of dementia. Okay, so delirium and dementia, please don't do any mistake in this. It's again a very favorite for exam setters, delirium and dementia. Then next question, a patient says, my thoughts are being broadcast on television and everyone knows them. Now what is this phenomena? The patient, again, if we take the keywords, the answer is given in the question itself. The thoughts are broadcasted on television and therefore everyone is knowing them. So this is a classical example of thought broadcasting, right? So it is a classical example of thought broadcasting. The patient thinks that my thoughts are being shared on television or say radio or through some social media, and therefore everyone is knowing what I am thinking of. So that is known as thought broadcasting. So the answer is there in the question itself, and I suppose no one can do these kind of questions wrong. So sometimes you have to think logically, and maybe in psychiatry you can reach up to the answer, right? So this is how you will go for thought broadcasting. Now, a patient presents with severe depression. So this is a case of severe depression. Apart from this, there are guilt delusion, and the patient is not eating anything, and there is high tendency of suicidality. Now we need rapid improvement. So what we should do now? Now here two important keywords are being given in the question. One important keyword is severe depression. Clear? It's a case of severe depression, but what is more problematic, that there is possibility of suicidality. So the patient can commit suicide. So severe depression plus tendency of suicidal acts, always and quickly go for electroconvulsive therapy. So severe depression plus suicidal tendencies, one should resort to electroconvulsive therapy. Okay, so this is how you should answer this particular question. Now, a 24-year-old man has social withdrawal, means he is not interacting with others. He has limited himself away from everyone. Muttering to self, so means talking something to himself only, and persecutory delusions. And all these symptoms are present for 8 months, and the active psychotic symptoms, they are present for more than 2 months. Now what is the likely diagnosis? So let us take the keywords here that will help us to reach up to the diagnosis. The very important keyword given here is social withdrawal, something like autistic behavior, right? No social contacts, no social communication. So social withdrawal, he prefers to stay alone. So something like autistic behavior. Clear? This is one thing. Then persecutory delusion. Persecutory delusion. Now in the very first question I have told you about delusion. Delusion means false, unshaken belief. So patient thinks that whatever I am thinking is absolutely right. And even if you tell the patient, see, whatever you are thinking is not right, it's absolutely wrong, but he will not listen to you. So that's known as delusion. Now, what is this word persecutory? Persecutory means people are trying to cause him harm. So people are trying to cause him harm, like they will try to take away his money, or they will try to take away his property, or they will try to attack him, they will try to kill him. Or if he is a student in school, he will think that my teachers are trying to fail me in the examination. So negative thoughts about the relatives or the teachers, and he just think that the people around him are trying to do some harm to him in terms of life, or some monetary loss, or if he's a student in some academics, like so some sort of harm. And this is persecutory delusion. And now coming to the duration. Now duration of all these is more than 8 months. So this all is a classical description for schizophrenia. The keywords are present for more than 8 months, and here one more word is written, one more line is written, active psychotic symptoms. So the active psychotic symptoms are for more than, they should be more than, for more than 1 month, and here it should be more than 6 months actually, to label it as a case of schizophrenia. So it should be more than 6 months, this should be more than 1 month. In the given question, it is for 2 months. So time wise, it's also getting fit into the definition of schizophrenia. Keywords, presentation wise, it's a classical case of schizophrenia. So this is classical description for schizophrenia. Okay, so please don't do any mistake in this question. Now a patient hears two voices which are discussing his actions, and this is in the third person. So what the patient is thinking, that suppose if two people are talking, most likely they are talking about me, my appearance, or about my activities, or anything, they are talking about me. So this is known as third person hallucination. This is known as third person hallucination. Now what is this word hallucination? Hallucination means there is no stimulus, but the patient is perceiving, right? So nobody is talking, but the patient is hearing some voices. So that is auditory hallucination, right? So this is which kind of hallucination? This is auditory hallucination. The patient is hearing some voices, and those voices are talking about the patient as such. So this is known as third person hallucination, which is a kind of auditory hallucination, and this is a classical sign of schizophrenia. And here this is running commentary hallucination. Now running commentary is just like a commentator is describing the whole incident of whatever is happening in the sports field. So similarly, he will hear voices, and the voices are continuously doing commentary about the activities of the patient. So that's running commentary hallucination, right? So this is third person hallucination, very classical clue for schizophrenia. Again, so this is schizophrenia. So therefore schizophrenia is a very important topic from exam point of view. Then next question, a patient is on some psychiatric medication and he develops coarse tremors, ataxia, vomiting and confusion, and this came after severe dehydration. So here let us take the keywords, and the important keyword here is severe dehydration. So severe dehydration has resulted in some complications like coarse tremors, then ataxia and confusion. So if you have this kind of presentation in which there is severe dehydration and classically coarse tremors, the drug in discussion is lithium. Clear? So what drug is discussed in the question? It is lithium, and we know that it is given for mania. So this is a classical case of drug toxicity, and we know that lithium has a very narrow therapeutic range, so we have to do therapeutic drug monitoring. If the plasma value increases beyond a certain level, obviously the toxic symptoms will appear. So the plasma value or the plasma range of the lithium has to be monitored, and that is known as therapeutic drug monitoring. So this is a classical description for lithium, and again the key topic is mania, that is mood disorder. So again very important. And then a schizophrenic patient develops fever, lead pipe rigidity, then altered sensorium, elevated creatine phosphokinase, and this is after antipsychotic therapy. Now what is the diagnosis? So again we can take the keywords first. The very first thing is the patient is a known case of schizophrenia. Clear? And the patient is on some drug, some antipsychotic drug. And now what is happening as a complication of this? There is fever, lead pipe rigidity, then altered sensorium, and more importantly elevated creatine phosphokinase levels. Now a patient of schizophrenia who is on some antipsychotic drug, and if there is this kind of presentation, the answer has to be neuroleptic malignant syndrome, right? So neuroleptic malignant syndrome. Now some student, they confused with it with malignant hyperthermia, so I have kept this box here. So this is neuroleptic malignant syndrome and this is malignant hyperthermia. So here you need to remember few basic differences. Number one, which after administration of. So NMS or neuroleptic malignant syndrome, it occurs after administration of antipsychotic drugs, whereas malignant hyperthermia, it occurs after muscle relaxants. Clear? Now which antipsychotic? Usually it is haloperidol, and which muscle relaxant? It is usually succinyl choline. Yes, so this is one difference. So in this given case, classically the patient is on antipsychotic therapy and most likely he is taking haloperidol. So this is neuroleptic malignant syndrome. Then second point is the receptors involved. Now in neuroleptic malignant syndrome, these are dopaminergic receptors, whereas in malignant hyperthermia it is ryanodine receptors, right? RYR. Clear? So dopamine, DA and ryanodine. So these are the two basic differences. That's how you will differentiate in case in exam if there is any question. So the very first thing which you need to remember or which you need to focus is like what drug the patient has been given. If the patient has been given anesthetic agent, then think of malignant hyperthermia. If the patient is on antipsychotic drug, think of neuroleptic malignant syndrome. So this malignant word here, actually the malignant word is common in both the terms, and therefore the students, they sometimes mix up. So please don't mix up. both the entities are entirely different. Okay, so neuroleptic malignant syndrome and malignant hypothermia, but in this case it is neuroleptic malignant syndrome. The next question: a student experiences recurrent intrusive thoughts of contamination but recognizes they are irrational. So this insight is what? Now here thoughts are coming into the mind again and again, and we discussed in the very first question, repetitive thoughts or recurrent thoughts, it is what? It is obsession. Repetitive thoughts or recurrent thoughts is obsession. Clear? And if the patient tries to do something, or if the patient tries to follow those thoughts, then it will be compulsion. Clear? So act is compulsion, thought is obsession. So here the student is thinking about some thoughts are coming into the brain again and again, so it is obsession. Clear? Now here you are getting this word insight. Now what does this mean? So the word insight is very important in psychiatry. Insight means that patient knows that whatever I am thinking is wrong. Clear? But patient cannot resist, although he knows that he is wrong. So that is known as insight, and insight is present only in neurotic disorders and not in psychotic disorders. So if we write insight here, it is absent in psychotic disorders and it is present in neurotic disorders. Neurotic like obsessive compulsive disorder, psychotic like schizophrenia. So this is insight. So the patient knows that whatever I am thinking is absolutely wrong, but patient cannot resist those thoughts coming into the mind again and again. So this is, the thoughts are obsession, and this realization that these thoughts are wrong, that is insight. Clear? So please remember that. Now a patient believes that neighbors are sending secret messages through newspaper headlines. Now whatever there is in the newspaper headline, although it has nothing to do with the patient, but the patient thoughts are like that those headlines has been kept by my neighbor, and the neighbor is trying to give me some secret message. So what is happening? The newspaper or any social media thing is actually a neutral event, right? So newspaper has nothing to do with general population, but here the patient is correlating the news headlines with himself. So this is known as the delusion of reference. So this is known as delusion of reference. So if we write some important delusions, one is of course the delusion of persecution, we already discussed. Then another is delusion of reference given in the question, and third is the delusion of nihilism. So persecution means causing harm. So the relatives or the teacher or the friends or the family members, they are trying to cause some sort of loss or harm or some threat to my life. So that is persecutory delusion. Then reference, neutral events are thought to be related to me. So that's reference. And nihilism means world is going to end. So nothing is going to survive. So that is delusion of nihilism or nihilistic delusion. Clear? So these are the few important delusion, and one we already discussed before, delusion of grandiosity. It means I am the richest person. Clear? So these are few delusions, and delusions we already discussed. They are false, unshaken belief which are not removed even after giving proper evidence against that. So this is delusion of difference. Neutral events are unnecessarily related to himself by the patient. A chronic alcoholic develops confusion, ophthalmoplegia and ataxia. So I think most of you can reach up to the answer very easily, like global confusion. Clear? Then second word is ophthalmoplegia, and third is ataxia. So the moment you have this kind of word GOA, you can straight away go to make a diagnosis of Wernicke's encephalopathy. So this is a classical case of Wernicke's encephalopathy, and that is related to the deficiency of vitamin B1, that is thiamine, right? So that's very basic. Then a patient cannot remember the events after a head injury, but recalls events before the head injury. So what type of memory loss is this? So suppose if this is the point of head injury, clear? And this is before, this is after. So what is happening here? The patient cannot remember the event after the head injury. So here there is no memory, but before the injury everything is present. So means old memories are present but new memories are absent. So new memories not being formed is known as anterograde amnesia, right? So if there is no memory after the injury, that is anterograde amnesia. So just two types of amnesia, and loss of memory. In retrograde you will write before the accident, and in anterograde after the accident. Clear? So before retrograde, after anterograde. Then a lady presented with paralysis of both the legs. So there is paraplegia, and this happened after an emotional conflict. And then anatomy, neuroanatomy is okay. Now what is this condition? So here let us write the keywords first. So the patient is a lady, clear? Then there is an emotional conflict, and after that she developed paraplegia. Clear? So there is paraplegia, and neuroanatomy is normal. So now what has happened? There is paralytic condition which is not related to the anatomical loss. It is because of psychological effect. So such a condition is known as conversion disorder, right? So here anatomy is okay. It's only because of some psychological issue the patient is developing some neurological problem. So in simpler words, what you will write? Psychological problem resulting in neurological problem. Clear? So this is conversion disorder, right? Please remember this. Then a depressed patient reports awakening at 4 a.m. daily. So every morning he will get up at 4 a.m. There is profound guilt, anorexia, and psychomotor retardation. So obviously the patient is depressed. Now what is happening? Let us take the keywords. One is awakening at 4 a.m. So this is known as early morning awakening, right? So the patient is getting up from the bed every day at 4 a.m. There is profound guilt, and also there is psychomotor retardation. So psychomotor retardation. Now retardation means slowness. This means slowness. So the patient is very slow to react, very slow to speak, very slow to take some decision. So that is known as retardation. So retardation means slowness. So this type of clinical picture in a case of depression is known as melancholic depression. Melancholic depression. And here, if you give a good news, patient does not become happy. Clear? So even after giving some good news, patient is not happy. And then there is one more classical word, that is anhedonia. Anhedonia means previously pleasurable activity are no longer pleasurable. Clear? So it means, suppose previously the patient was very fond of going to movie or eating ice cream. Now he don't find any interest in going to movie or eating food of his choice. So that is known as anhedonia. So these are classical words, and the moment you get these kind of words, think of melancholic depression, right? So classical is early morning awakening, anhedonia, psychomotor retardation, feeling of guilt. That's all melancholic depression. Then a patient claims to have terminal cancer, and then patient will try to prove that, okay, I am about to die. So the patient claims to have terminal cancer, but when the investigations were done, all were negative. The patient were absolutely fine, and the only motive of the patient was to seek sympathy from doctors. So here, let us write the keywords. Now what the patient is doing here? Patient is claiming of severe illness from which he will die soon, and this all is to seek sympathy of doctors. Obviously the investigations are all normal here. So what the patient is trying to do, he is just trying to simply gain sympathy of doctors. So such a kind of disorder is known as factitious disorder. So in factitious disorder, what is the ultimate aim of patient? To gain sympathy of doctor. Now in malingering, the patient is also claiming to have some disease or some problem, but the motive is different. So the two conditions are differentiated based on the motive behind this claim of having severe disease. In factitious disorder, it is sympathy of doctors. So no need of money, nothing, just sympathy of doctors. But in malingering, the patient wish to have some external gain. It can be in terms of money or some leave from job or something. There is some specific purpose behind all this play. So in factitious it is all sympathy of doctors, but in malingering it is to gain, to get something. There is some purpose behind all this drama. So these are the two conditions and how they are differentiated, right? Then the last question, a medical student repeatedly washes hands and he thinks that there is contamination. So here contamination thought is obsession, right? So this is obsession. So the medical student will think that my hands are contaminated. Now what he will do? Because of this thought, he will do some act, and this activity here is washing of hands. So washing of hands is the compulsion. Clear? So this is how beautifully we can understand what is obsessive compulsive disorder. In obsession there are thoughts, and in compulsion the patient is doing some activity. So in this particular case the thought is of contamination and the act is of washing the hand. So very easy to understand. So this is a classical case of obsessive compulsive disorder, and how you manage. The first line drugs are SSRI, and the classical example is fluoxetine, right? So answer here will be fluoxetine. So this is enough for this session. I am very sure you must have enjoyed the session. Thanks for joining. Good night.